All right. Thank you, Zane. I'm Tara Gregory, and as Zane said, my colleague, Dr. Sarah Jolly, is also presenting today. I'm the director of the Center for Applied Research and Evaluation. So we're one of the centers under the Community Engagement Institute. And as our name implies, we only focus on research and evaluation. And so we're the data nerds. And that's why we got to kick this off, because we're so much fun. Everybody wants to know how to use data, and so obviously we are the fun ones to start off here. But Sarah is the evaluation projects coordinator, so she does a lot of work on various research and evaluation projects for us, primarily focused on public health, but basically anything we ask Sarah to do. So we've both been here 20 years plus. So this is something we've done for quite a while. The subtitle today is "When you know better, you can do better." I know that's kind of a paraphrase of a famous quote, I think from Maya Angelou. The way that we mean that is that when you have better information and you understand it better, you can do better things for the people you serve, or the people who are in your community. And so, we're kind of taking that quote out of context a little bit, but we really feel like, if you're collecting data, you're paying attention to it, then you really can use it to make better decisions about moving your organization forward, moving your program forward, and helping the people you serve in the way that you really want to. A lot of times people will collect data and kind of go, okay, we did that, and we've got some data, and they don't really take the time to look at it and figure out what it's really telling them. So today we're going to go over a lot of different things to try to help support how all of this stuff related to data can come together to really help you tell a story about what you do that's more cohesive than just this piece of data, that kind of thing. So Sarah, you can go ahead and go forward. This is our building, the Community Engagement Institute. And like I said, the Center for Applied Research and Evaluation is one of the centers under the Community Engagement Institute. Zane works in the Center for Organizational Development. We have the Center for Public Health Initiatives. We have an impact center that focuses on student engagement. And then we also have prevention initiatives. So a number of different things going on under the umbrella of the Community Engagement Institute. As Zane suggested, go to our website, check it out, contact any of us for more information. If you need evaluation, that'll be me or Sarah. If you need something related to organizational development, Zane can help, but we have a lot of people throughout the Institute, and we all work together as well as being in separate centers. So that's a little bit about the Engagement Institute, if you didn't know about us. So today what we're going to be doing is we're really going to frame this in terms of storytelling, because data can be kind of daunting for people, and people's head kind of starts swimming when they see a bunch of numbers in front of them, or even a description in front of them. So we're going to talk about how do you use your data to tell a story that means something. So what's the story we're hoping to tell for the organization, the program, the clients? What information or data do we need to tell that story, to confirm the story, or to not confirm it? And how does the information data we have confirm or not the story we had planned? And what might that mean? So kind of interpreting the data, and then using the data as storytelling process to become a learning organization, which is all about really making sure that you're using that information in a way to make your organization the strongest it can be, to make the program the strongest it can be, and to really serve the people you serve in the best way. So those are the things we're going to be going over. It's going to be a lot, and we're going to be jumping around a little bit, but hopefully we'll bring it together kind of, again, within this framework of how do you use data? What kind of data do you need? And then how do you use it to tell a story? So, all right, Sarah.
All right. Hello. So we are going to start out with what is the story we are hoping to tell? So we'll start here. So what is the story? So at the beginning, what is going on? What are the current conditions? So when you think about your organization, you think about your program, what are the current conditions for whatever the people you serve, whatever issue you're trying to tackle? What are the current conditions and what needs to happen and why? Who are the actors involved in that process? What are the actions being taken? So when you think about a story, there's usually a protagonist, there's action that happens, there's some obstacles, there's some barriers, but there's also progress that gets made. And then if you think again about a story, you have sort of a happily ever after in theory that comes at the end of the story where everything is sort of tied up neatly. So what is the happy ending that we are hoping for in this case? So being able to think about things in that sort of way. So one of the things, and I don't know for folks who've been on the call, Tara and I have done another webinar on story through a logic model. So we've done a logic model process. We do a whole webinar on this. And we've done work with organizations one-on-one where we do half-day processes and work through the development of a logic model. So a logic model tells the way your program or your organization works. So it's the story of how the things that you do are logically connected to the outcomes that you seek. So these are helpful for planning, helpful for evaluation. For a long time, they were a requirement for funders. I don't know if they still are quite as much, but this helps you think through if you're using data to tell a story. The first step is really figuring out what data should we be looking at? What data do we need? Where can we find that data? And a logic model can really help you in that process. So I'm going to show you, this is what a logic model template looks like. And again, we do an entire webinar where we go over this and walk through each of these in more detail. That's not what our goal is for today. But if you are interested in learning more about logic models, please reach out to me, reach out to Tara. We love talking about logic models. We love doing logic models. We think they're super fun. So if you don't think they're super fun, come find someone who does. We'd be happy to help you. So again, we're not going to go over these in detail today, but certainly let us know if you need more information. But these outcome boxes, those 3 boxes on the right, those really help you identify possible data that might be of interest and also data collection points. So where you might have the opportunity to gather data that will support the story that you're trying to tell.
And Sarah, if I can jump in just really quickly on that. I think if you look at and again, we're more than happy to help people. If you don't know how to put together a logic model, this looks really daunting, but all it is, again, it's the story of who do we serve? What are those people experiencing? Who are they? What do they look like? Where do they come from? That kind of thing. And so again, if you think about a movie, you have those characters and like, oh, this is why we care about these characters. And then your inputs are the things that you have to help those people. Your activities and outputs are the things that you do in order to help them. And then as Sarah said, the outcomes are, and so what are the changes as a result? So again, if you think about the story, you need to know, okay, who are the people in the story? What's happening to them? And then what changes or what's that happily ever after, or sometimes maybe not so happily ever after. But if you think of a logic model in that way, we think it's not as daunting if you just think about it as telling pieces of your story in a way that makes sense, that shows how, who you serve and what you do for them creates these outcomes. So sorry, I just wanted to provide that little tidbit from our other workshop.
Yes. And again, Tara and I love logic models. We could talk for a whole hour and a half about this. And I do think, you know, since Tara called us back to this, thinking about the short-term, intermediate, long-term outcomes, you can see short-term outcomes are focused on the individual that you're serving, right? Changes that happen in their knowledge, their attitudes, their beliefs, the skills they have. And those things are what help lead to those intermediate outcomes. So remember, this is a logical connection for how that story unfolds, that changes in knowledge, attitudes, beliefs, and skills can help then lead to changes in behavior, changes in decision-making, changes in practices. And those things then connect logically to the bigger outcomes that you're looking to have. Okay, so what information or data do we need to tell the story? So again, we looked at the logic model as a story framework, right? So what information or data do we need to tell the story? So one place you can start is thinking about methods of data collection. So when we think about how do we get the data we need, how do we get it, and where might we find it? So in some cases, you might have existing records. So you collect data regularly from clients, patients, people that you serve. So you might have existing records that you can access as one piece of data. There is also secondary data that is publicly available and can be accessed by anyone who is interested. So things like census data, data from the CDC, births data. There's a lot of publicly available data sets. Some of them can be more difficult to navigate than others. And there are folks who know how to do that. So you can also look at a website like Kansas Health Matters. Kansas Health Matters is kind of an aggregator of data from a lot of different places. So if there are particular variables that you're interested in, conditions you're interested in, geographic areas you're interested in, those are places that you can go to access secondary data that's relevant to whatever your work is, whatever your story is. Surveys, interviews, and focus groups, those are other data collection methods that are often used to gather data from individuals who are impacted by the work that you're doing. Interviews and focus groups are more qualitative in nature. Surveys tend to be more quantitative, not always, but there are quantitative and qualitative data collection, primary data collection methods that you can utilize as well. So also types and sources of data. So there are methods of data collection, and then there are types and sources. So needs assessments, those a lot of times can help provide a baseline. So again, back to what are the current conditions? What are things like right now before the story begins? And needs assessments can use all of the data collection methods we saw on the previous slide can be a part of a needs assessment process. Outputs, those provide information about what is happening, right? What are we doing? How many people are there? Outputs are tracking those things. Outcomes, again, help you lead toward that happily ever after story. You saw the short-term, intermediate, long-term outcomes. There's data that connects to each of those types of outcomes. And continuing with regular needs assessments, regular data collection, ongoing types of data collection, information gathering, those are the things that help you monitor outcomes and really be able to show change or impact over time.
And we're going to talk more about each of those. So if you
Yes.
are like, I don't know what an output is, or I don't know an out, we'll talk more about that in a few minutes.
Yes, we promise we will get there. And also, if we don't get there, let us know. Ask a question. I am the one sharing my screen, so I might have trouble tracking the chat, but I think Zane keeps an eye on chat, and hopefully maybe Tara's keeping an eye on chat too. But if you have a question, please let us know. We're happy to answer it now or later, either one. So, all right. So now you have some data. What are you going to do next, Tara?
I don't know. I wasn't looking at my slides. Okay, yeah, so we very briefly, and I know this is very brief because we're trying to get a lot in here, but what Sarah just talked about was kind of how you get data or where you can get data. And so now we're going to talk about, okay, so what do you do with it? And a little more in depth about like, you know, interpreting it and making sense of it, because as I said, a lot of times We come across organizations that will say, oh yeah, we've collected data for years and years, but we've never really looked at it. And that's okay. We understand that organizations are there to serve people, not to sit and look at data most of the time. But if you don't look at it and you don't think about what it means, then it's not very instructive in helping you move forward and do better. So we're going to talk now about, so you have the data, maybe you have some existing records, you collect client data, or you have meeting notes, that kind of thing. Maybe you've done surveys, maybe you've done interviews, you have access to the secondary data. So now what do you do with it? So go ahead, Sarah. So just to kind of reiterate the things we've been saying, so having appropriate data allows you to draw connections between what currently exists. So for anyone, even for people who are doing relatively well, or communities that are doing really well, it's good to have kind of that sense of, this is where we are right now. This is what's going well, this is what's not going well. Needs assessments often provide that information about, well, we don't seem to have much of a problem here, or man, we really have some gaps here. It's good to know that in general when you're starting to look at your data of what's the starting point. What are you doing to address it? We've said that several times, of documenting what you are doing is an important part of this. And then what the results are, and those are the outcomes. So, if you track all of those, that really is your story of, this is the beginning, here's what we did, and now here's how we're ending up, or here's where we are right now. So it kind of shows that journey and that story that you've been on. Okay. So again, just having the data is different than really making sense of it. So I could, create a report, and you could look at it and go, okay, we're down 7% there, we're up 9% there, oh, we're down 15% here, we're up 2% here. Okay, great. So all of that's data, and those things may tell you something, but it's really about looking at that and really thinking through, what am I seeing and what does it mean? So some questions to ask yourself when you're looking at your data, whether it's client records or surveys or interviews or whatever, these are kind of the steps that we go through when we're talking to people about their data, or when we're collecting data. So to what extent does it reflect yours or others' experiences? We often do this when we're doing like interviews or focus groups. We'll take like some secondary data that says, I know that during COVID, there was some data that said that rates of violence were up. And so we would use that data and talk to people about, are you seeing that? Is that consistent with what you've seen? Is it not? And so, kind of trying to make sense of what the data is telling us, and whether it's reflecting of what's really going on within that community or within that group. What's unexpected about it, or what's totally expected about it. Again, when we talk to people about the increase in violence during COVID, we had people telling us, oh yeah, totally expected. People have lost their social skills. We had police telling us, yep, people have masks and they feel like they're, they can act with impunity. And so, when you start really looking at the data and asking questions about it, then you're kind of led to, what are the possible explanations for this? And so I just gave you a couple of examples of what people were telling us about violence during COVID, of, yeah, people are more socially isolated. So when they do come into contact, their social skills have degraded a little bit. And then also sometimes people felt like they could act without consequence. Does it show a theme or follow a trend? So I'll leave behind the example with COVID right now, But if you we really encourage people to look at more than just 1 or 2 data points. So if I collect some data today, all I can really talk about is what's going on today. That's point in time data. And that's okay. That's good to know. This is what was going on April 16th, 2025. Good to know. But it's even better if I collect that same data in maybe June. And then I can go, oh, look at what's going on between April and June. And either things stayed the same, they got worse, they got better, whatever. But what's even better is if you have 3 points or more, so that you can kind of flatten out some of the things that may just be random things that happen. You know, we've had situations where, something really unexpected happens and it'll cause some of the outcomes we're looking at to really jump. And so we want to allow time for that to kind of go away. I go back to the COVID thing. When we were doing the needs assessments during COVID, and we did quite a few of them, we knew that the data we were collecting at that time was going to be different when we got out of, lockdown and all of that. And so I would guess we have one community where we do needs assessments every 5 years. And so I would guess that the data we saw in 2015 versus 2020 versus 2025, which we haven't done yet, is going to be pretty different. But with those 3 data points, we'll be able to say, oh, basically, this is the trend in this community. This is the theme in this community. And, so having multiple data points is pretty important. Again, you don't have to have that. Sometimes it's not possible, but it is nice to have that, to be able to look at a theme or a trend over time. And then a really important thing is, does it affect certain populations more than others? And are certain groups missing from your data? We know that we do a lot of surveys, and we've looked at literature on this. We've talked to other people. What tends to happen with surveys are that the respondents are the majority women. They tend to be a little higher income, mid to high income, tend to be English speaking, even when other languages are offered. And I'm missing one, tend to be higher educated. That tells us something. I mean, it's good that we get some information from the people in those groups, but we know we're missing some people in that. And so, at the very least, we need to identify that this is who this data came from, and we're missing information from Spanish speakers. We're missing information from people with lower incomes. We're missing information from men. And so being able to look at your data and recognize who you're missing can, one, guide you to other data collection, which that's something that we tend to do in a lot of our work, is when we know the surveys are going to get this particular response, we set up kind of some additional methods to go to groups that are Spanish speaking, or go to groups that have access to people with lower incomes, or that kind of thing. So again, it's really important to look at your data and not just go, okay, up 7%, up, down 9%, whatever, but to look at that whole thing and say, wow, what does this tell us about what's going on here when we're seeing these things going up, these things going down, and over time, we've seen this thing going like this. If you're familiar with like substance abuse data goes up and down like this, kind of depending on what drug is popular at the time. And but if you look at it over a number of years, what has actually happened with substance abuse in general is that it's gone down for the most part. There are some blips every once in a while, but it's gone down quite a bit since like the 1980s, 1990s. And so that's the value of having multiple data points and really looking at things over a period of time. Okay, I probably said way too much on that, but let's move on and talk about outcomes. So we're talking about outcomes here specifically. We really feel like outcomes are the most important thing to track because they tell you whether you're making a difference and whether you're making the changes that you want to make. Unfortunately, outcomes are some of the more difficult things to collect. You can get them from secondary data, but that tends to be really large data sets that primarily tell you about a particular geographic area. Surveys are pretty good about getting outcomes. Of course, you have to rely on self-report and people being honest and remembering things accurately. You can certainly get them from interviews and focus groups and those kinds of things. And if you're an organization that works specifically with individual clients, your client data is going to be really valuable in looking at outcomes. But this is really about what changes for the people that you're trying to impact. Some things, again, I mentioned you can look at individual client data, but in figuring out whether you're really making a difference, you need to kind of zoom out and look at data on a larger scale. And so rather than focusing on, did this individual get better? Did individual 2 get better? Did individual 3 get better? That's important to know for them. But it's also really important to understand, is our program doing what we think it should? Is our organization doing what we think it should? Are we making good financial decisions? And so you look at data in aggregate and specifically look for changes across time. And this applies to individual data as well as programmatic or organizational data. But look at changes across time, and again, looking at the aggregate. So did the bulk or, did the average for all of the people we serve go down or up across time, depending on what we want to see? Are there changes for certain populations or communities? So again, looking at the change across time based on certain populations or communities that you might be dealing with. Changes based on certain programs or interventions. You might have several different programs going on to address parenting. Are the changes different depending on the program? And if they are, then you might want to look at, gosh, are we serving really different people in those programs? Do we have different staff? That's the last one, changes by staff or the people who are implementing the programs. We do some evaluations of programs where we can see that certain staff, their classrooms or their clients tend to do better than others. And that's not an indictment of a particular staff person. A particular staff person may have a more difficult classroom, or they may have clients with more severe issues. But being able to look at those kinds of things and really dig into it. And again, we're not saying you all need to become researchers and know all of the tricks, but even just kind of eyeballing the data and picking it out and saying, oh, wow, Sarah seems to be doing better than Tara at, retaining staff or whatever. That's something that's relatively easy to look at, but a lot of times we kind of forget to do that, in day to day and not dealing with data all the time. Okay. So this is kind of calling back to the logic model, but if you remember the short, intermediate, and long-term outcomes that we're really focused on are primarily short-term outcomes are changes in knowledge and awareness. And so if you're implementing a program, a relatively simple thing to do is to just ask people, did you learn something from this? Do you feel like you're better equipped to address this now? Did your awareness of this issue change? And, again, self-report can be iffy sometimes, but sometimes it's the best you can get. And so at least try to do that so that, particularly if you're doing like training, or workshops or presentations or something like that, it's good to have that kind of information. Also looking at changes in attitudes or beliefs. There's an idea that in order to create societal change, you have to start on the individual level by changing people's awareness about the issue. So for example, I don't know, the 1960s, 1950s, everybody thought smoking was great, and gosh, doctors were promoting it and all of that. But at a certain point, the research started coming in that, hey, this causes cancer, there are all kinds of negative things going on. So building the awareness of the public was the first step. And so, people starting to know, oh, wow, okay, maybe this isn't so great. Even though the commercial 10 years ago said my doctor recommended it. So changing the awareness. And then you have to change the attitudes and beliefs. And so, gosh, I know smoking is bad for me. But if my attitude is still like, yeah, but I love it and I'm not giving it up, then chances are I'm not going to make changes. So you need to start changing attitudes and beliefs. And so that's why we start looking at attitudes and beliefs for short-term outcomes. One way to do that, it's kind of hard to ask people, do you feel good about substance abuse? People aren't, there's some social desirability related to some of this. And so a lot of times what we do is we ask people how competent they feel about things, how confident they feel about this information, whether they feel the information is helpful. And then we also ask them about their intentions. Do you intend to do something about this? And so that kind of gets at their attitudes. It's kind of a proxy, but it's one way to kind of, backdoor ask people, how do you feel about this? And saying whether they intend to do something different or not is a little bit softer than saying, do you think this is a good thing or not? Kind of depending on what it is. Changing behaviors comes further down the line. And that's a little more difficult to measure because sometimes you would have to follow people across time. Say, for example, you do a budgeting seminar for people with low incomes. You can assess their knowledge gain and you can assess things like, yeah, I feel confident in using this information. Yes, I intend to go home and create a budget or whatever. You can measure those things pretty simply through some sort of a survey, but changing in behaviors requires some follow-up. You can do that. You can check in with them 6 months later and say, hey, do you have a budget? Hey, have you reduced your spending, or whatever questions you want to ask, but it does get a little bit more difficult. So using that logic model, we know that if you change knowledge, awareness, you start to chip away at attitudes, beliefs, chances are you're going to impact behavior. So if you can do nothing else, just assess knowledge and awareness or attitudes and beliefs, because that's kind of the domino that starts the rest falling. So changes in behaviors, if you can capture that, that's wonderful. And then changes in community conditions is much further down, and you tend to look to publicly available data for that. And so, Sarah, can you say your thing about attribution versus contribution? I always get it wrong.
Absolutely. I would love to talk about that. So when we think about those short-term outcomes that Tara's talking about, things where you're measuring changes in knowledge, attitudes, beliefs, skills, those are things that are probably directly or fairly directly connected to the work that you're doing, the action you're taking, the program you're providing. So you can take that data and be like, we did that. That was us. And as you get farther away from that short-term outcome, so as you move toward intermediate outcomes, and really as you move toward long-term outcomes, can you say that the changes in substance use rates in your community are solely the work of your organization? You can't say that because there are a lot of factors that contribute to that, right? So you don't have sole attribution for the changes that you see in those longer term outcomes, but if you've been collecting other data, you can say, we had some level of contribution to those changes that we're seeing. It's not only us because there's other stuff happening, when you think about those longer term outcomes. So you can't take sole credit for it. It's not all you. It's not all attributed to you and your work, but you can, if you have other data to help sort of support the direction your folks are moving, you can say, we contributed to that. We believe for these reasons that the changes we're seeing are something that we have helped contribute to.
Very good, thank you. I always mess that up. I don't seem to be able to say it the way Sarah does. But again, you know, if you think about that logic model, we really encourage people, think about short-term outcomes at least. If you can capture intermediate outcomes, that's great. But because you have linked things logically, it's okay that you don't collect your own data. Maybe you can't even get data on behaviors. That's all right. You've got the short-term, the data on short-term outcomes. And you definitely probably are not going to be able to collect data that says how you have impacted the community yourselves. So use publicly available, that secondary data for that final column in the logic model. And so it all connects logically, that if I knock over this domino, the next one's going to fall, and then the next one's going to fall. And so that's, again, kind of how you tell your story. I want to say real quickly, just Sarah, you can go ahead. We do have a template that we use for like presentations and trainings and workshops. And if any of you would like to use that, please let us know. We've set it up so that it looks at knowledge change, it looks at attitudes, and gets a sense of intention. And so, you know, if you want to start doing some sort of surveying of people who go through presentations or workshops or conferences or whatever, we'd be happy to provide that with you. And it's kind of blank. You just fill in your topics and that kind of thing. So just let us know if you want that. I just wanted to show you a couple of pieces of data here. This is some data from an actual report that's been published on the Early Childhood Block Grant. We do the evaluation for that. And so we've de-identified this, so you don't know who this is for. But this shows you a little bit about change over time. One of the things about this is that the little gray dots are the individual children and their test scores on whatever test this is. And so, you know, this is a nice representation of, yep, we've got all this individual data. And then for this test, there's a benchmark that says that the kids are kind of on track. And so you see that gray line that shows the benchmark. And so just eyeballing this, you can see, oh, okay, a bunch more kids are above the benchmark at the second testing versus the pre-test. And so right there, you know, you've been able to use your data to go, okay, all right, great, we're doing pretty good. We've still got some kids below, but not nearly as many as we did before. And then on top of this, we've overlaid data for all ECBG grantees and kind of where they were at pre-test, where they were at post-test. That's that little sunflower looking icon. And then where was the grantee average? And so these are all things you may not create. I have no clue how to create this chart. Our ECBG evaluation team does that. But you know, you have all of those pieces of data that you could look at from the individual scores to the benchmark to the averages. So there's the average for the grantee, the average kind of compared against the state. So all of that is really valuable information rather than just looking at, you know, this kid did well, this kid didn't. This is how you start to pull it together to figure out, okay, this program's going pretty well. We've still got some kids down here that we may need to pay some attention to. Right there, you have set yourself up for making decisions based on data. All right, let's go to the next one. This one has a whole bunch of data in it. And we're just really kind of showing you how you can compare data. I'm not suggesting you need to create these graphics. If you know how, that's great. But this is just showing how you can overlay a lot of information and be able to make some decisions based on it. So the first is, again, comparing a couple of different groups. Maybe they're in different interventions or programs compared against Sedgwick County as a whole. And then it's also broken down by race. And so you can kind of see the average scores for each of the groups there. So, and this one is showing, I'm not sure what this, it may not be test scores. It might be percentage participation or something like that. And so, or it might just be demographics. So anyway, I won't make guesses about what it's about. But it shows you a lot of different information all at once that, you have these two different groups, and then you also have it by race and then compared against the county. And so looking at data in that way, it really helps you develop a more full picture of your programs. Secondly, again, this is just another one that kind of shows a couple of different groups based on, and then the results by ethnicity compared against Sedgwick County. So there's, if you gather data, there are a lot of different ways to look at it. And I know these charts can look a little bit complicated, but it really is just asking yourself that question of, how's group one doing against group two? Or how is this program doing compared against the Sedgwick County stats? Or how are people doing based on race or ethnicity or socioeconomic status or whatever it is? And so there are a lot of different ways to look at data to help you make sense of what is our program doing and where is it making the most difference. And it can identify, again, where you're really successful, where you need more focus, and maybe where you may need to change your approach. Okay. That was a lot. Hopefully I didn't lose anybody in that. So, but outcomes are really important. And that's why we kind of put a lot of focus on that.
Yes, outcomes are critical to the story that you're telling, and they're critical in decision making for your program and your organization. So we don't want to overlook outputs. Outputs really are, a lot of times, they are a necessary component for your data collection. And a lot of times they are required. Like, these are your accountability measures. If you have grant reporting you have to do, if you have to provide reports back to funders, outputs are the things they want to know about. They want to know that you spent the money the way you said you would, that you held the number of trainings you said you would, that people showed up. Those things matter. They're not evidence that you made a difference, but they're evidence that you did something, and ideally that you did the things that you said you were going to do. So again, the outputs aren't the product. They're not evidence of effect, but they are evidence that you did something. And remember, those activities are the things that contribute to change. So knowing that you did the things you said you were going to do, that accountability piece, those things help move you in that direction. So you need outputs. So outcomes are critical to your story. So are outputs. They're just a different piece of data, still a necessary piece. I will say, typically boards love to see the outputs that you all have. These look really pretty as infographics in an annual report, things like that. This is, again, information that is important to have, evidence that you are doing the things you said you would do. And hopefully then, as you move on to looking at your outcomes, you can connect the outputs, your activities, to your outputs, to your outcomes. So we did just want to have a quick note on outputs. I also want to say, so these are examples of what outputs are. So right now we are on this webinar together, and there are 84, my count says 84 participants. So check. Tara and I successfully taught 84 people about how to use data. That's not, we don't have evidence that we successfully taught 84 people more about outcomes and data and storytelling. We know that 84 people attended this webinar. We know that, or at some point, I think it was at 91 or something. But so we know the number of attendees. We know that we held this event. We know that you heard Zane mention this is a 5-part series. So at the end, we can say we held 5 webinars. This many people attended those webinars, but is that evidence that anyone learned anything? Some people might just be eating their lunch and scrolling Facebook or doing whatever at this exact moment, and they aren't really listening. That's okay. I'm probably guilty of that too sometimes. But us holding a webinar is not evidence that anyone learned anything from said webinar. You heard me mention a moment ago, we'll send a survey at the end of this. It'll have questions that say things like, this was a good use of my time. I feel like I learned something. I would recommend this to others. Those are things that get beyond just the outputs of 84 people were there. So those are ways that you kind of move beyond. So if it's something, this is just like my little like trick test thing is this an output or an outcome? If you counted it, it's probably an output. That's not universally true. There are some times where the thing you counted can be an outcome, but most of the time, if it is something that you counted, it is probably, not always, but probably an output. So just something to think about as you make distinctions between outputs and outcomes and how you want to report those things out and how they contribute to your story. So just a quick note about objectivity. So you can see the little definition of that. But as you look at your data, consider multiple interpretations of what that data might mean. So think about the context. Think about multiple data points, multiple data sources. When we look at these things all together, what might this mean? And sometimes it's not always the thing that we had hoped, right? Sometimes things beyond our control happen and the outcomes we're seeing are not the ones that we planned on. But remember, the purpose of data is to help guide you to make better decisions, to make to better serve the people that you all care about or advance the causes that you care about. And so removing ourselves, our investment in it is sometimes hard to do, but being able to sort of pull back for a second and see what might this mean. And you might have multiple explanations for what might be going on. And how do you dig into that a little bit more? Also, sometimes it's worth checking in with the folks who the data is about, right? So talking to people, you heard Tara talk earlier, checking in with people, how is this data consistent with your experience? How is it different from what you're seeing, from what you experience? It's actually like an official research thing. It's called member checking, where you talk to folks who are impacted by the data that you are looking at. So objectivity, again, means sometimes you might come to conclusions that you don't necessarily like, or you're not really happy about, or maybe you're not super proud of. But again, the goal is to strengthen the work that you do. So that's why we try to step back, check in with others, and get as many interpretations for what might be going on as possible. So we did want to add just a quick note on learning organizations and what it means sort of to be a learning organization. So this is kind of a lot on a slide, but the TCC group is an organization that has done a lot of work on organizational capacity development. And if you want more information about their work, they are at tccgrp.com. I'll drop that in the chat in a little bit, but this is their model of organizational capacity. And I have highlighted adaptive capacity because that is really what's connected to being a learning organization. So that's the ability of a nonprofit to sort of monitor, assess, respond to, and create internal and external change. So this is the ability for you to learn and to adapt as an organization internally and externally to best achieve your mission. And you can see the other elements of capacity as well. I'm not going to go into those because I know we've got about 9 minutes. So I just want to make sure that we get through all of our content. But as you think about being an adaptive organization, an organization with high adaptive capacity, things that are involved in that is having regular and thorough needs assessments, having an organizational assessment regularly, being able to look in at your programs, having a strategic plan, looking at collaboration and partnerships. Sometimes other organizations have access to information that is beneficial to us as well. Or there are ways for organizations to share data. I know that sometimes that's a dicey thing, but there are ways to share and collaborate and learn more together when there are organizations that care about making progress on the same types of issues, on the same types of things. So one of the things I really want to sort of hit home here again at the end is to really use your data. Whatever data you have, use the data to make changes when you see that those might be needed. You heard me say, pick some items. 2 data points is not a trend. 2 data points is information, and it's great to have. 2 data points is not a trend. So these numbers are different from last year to this year. That doesn't necessarily mean that things are getting better or things are getting worse. 2 data points or 2 data points. And you got to start with 2 before you can get to 3, right? So 2 data points isn't a trend, but start looking at data over time so you can build something that allows you to talk more about trends, long-term themes, things of that nature. Have a portfolio of success stories or even challenges. Those types of things help build a case to funders, to people who might want to support your organization financially or volunteer for your organization. Just keep asking questions. I am a big question asker. I love to ask questions. And just ask questions that lead to maybe more data collection. So what else do we need to know? What else would help us better do this work? What information would lead to the best possible outcomes for the people we serve? How do we best achieve our mission? What do we need to know to make that happen? So ask questions that lead to more data collection potentially. Also ask questions that lead to more data meaning. So you heard me talking about like asking more people, what might this mean? Like, what does this information tell us? What is the context here? What might we do differently as a result? What might we keep doing in the same way? So lots of questions that can help create meaning for the information that you have. And I'm going to turn it back to Tara to wrap us up here in the last few minutes.
Yep, and I will just say one thing too about, as Sarah was talking about asking questions. Sometimes I know, we do program evaluation, and people can be really nervous about, oh, you're judging us, you're going to say bad things about us. And that is not the role of an evaluator. The role of an evaluator and the role of anyone looking at data is really about helping expose what's really going on. Not expose is probably a bad word because that sounds negative, but helping to highlight what's really going on in this program. And I will guarantee you that funders are not looking at you going, man, if they make one mistake, they're out. So going back to a funder and saying, this did not work the way we thought it would. We've got to regroup. That's okay. And if you have some data to back that up that says, we thought this intervention was really going to work, and then we discovered that maybe it was the wrong population or, something like that, as long as you have some data to kind of back it up and say, yep, this didn't work out great, but we're going to do better. We know now. That's a good thing. And again, evaluators aren't sitting there, trying to do a gotcha, and neither are funders. So to wrap this up, bring it back full circle, let's go back to storytelling. All right, go ahead, Sarah. So this is basically from needs to outcomes. We primarily have focused on, we've talked a little bit about needs assessments are important, and needs assessments don't have to be a big, huge thing. We get paid to do community needs assessments, but your needs assessment could be reading over, client data and saying, oh man, we have a lot of clients who need this, or it might be looking at some secondary data and going, wow, this is really an issue in our community that we want to address. And so, you know, just having a sense of what the needs are in your program or your community is a really important thing. And that's the beginning of your story of this is the condition as when we started. So describing the needs you're addressing, how significant they are, and who's most affected is really important to kind of frame everything and get it going. Identify what you're doing specifically to address those needs. So that's where you're, you know, documenting your activities and identifying your outputs. How many people attended? How many times did we do this? How many materials did we give out? That says you were doing something. And then providing evidence to show that you're making a difference. Those are the outcomes. And what are those differences? You know, gosh, you know, they gained awareness, they gained knowledge, their behaviors changed. This community condition is better, and we think we contributed to that. And so that's the story. Again, we went through a lot really quickly. I hope that it helped you think about data in a different way. If nothing else, if you walk away with the idea that this is part of my story, how can I use data to tell a story to people who are interested in our program or to funders, and being able to say, you know, 25% of our population needs this. Here's what we plan to do for them, and here's how much of it we plan to do. And we hope to see, or we are seeing, a 5%, you know, drop in this and a 10% increase in this. That's your story right there, and you're using data to kind of anchor each piece of it. So with that, I know we're at time, just about. We're happy to take any questions, and I think Zane knows how to get a hold of us. If it's not on, I can't remember, I don't think it's on the next. Oh yeah, there are email addresses. Feel free to contact us, just our first and last name at wichita.edu. And we are always happy to respond and, you know, provide whatever resources we can. So with that, I think we're done.